Good morning. My name is Brian Pilcher. I am Chief Scientific Officer for actually a partner of Sinclair, Soneva Medical. And I'm going to talk to you today about the InsuLift device, which is a thread-based device. It's a non-surgical procedure you can add into your practice for patients who are not yet ready to have a facelift. And what we know is that it offers you the longest lasting lifting capacity while also stimulating the patient's own collagen. Before I get started, I need to give you a little bit of a disclaimer. I'm used to giving these presentations at night in steakhouses, and so I'm an academic scientist by training, and so I always like to titrate things out. And I know I can have about a glass and a half of wine and be really good on stage, right? It kind of lets me get out of my introvert shell, but I also know if I go to 2 glasses of wine, I lose the ability to think clearly and can't finish my sentences. So what I'm telling you is I've had no alcohol this morning, but I've had about 6 cups of coffee. So this 20-minute presentation may be 3 minutes, I don't know. Okay. You've heard a lot about regenerative aesthetics, and I'm going to talk about it from the perspective of the company, okay? And I'm not sure if Sinclair believes this, but I do believe that they do because they're talking a lot about this today. You've heard from 2 providers already that tell you about how they think about regenerative aesthetics and regenerative medicine. This is absolutely the future of aesthetics. There was a slide in one of the earlier talks where we talked about the fact that hyaluronic acid use as a dermal filler is actually going away. If you look at both Allergan and Galderma's latest reports, they are saying that year over year, HA usage is down 30%. That's a significant amount, and people are now trending towards these treatments like exosomes, PRF, PRP. So the patients are walking in, and I'll show you data that we have from our own internal studies with patients that demonstrate the regenerative aesthetics message is very much something that they're interested in. I would much rather have something placed into my body that is natural and is going to cause at least a portion of that cosmetic effect to be due to my body's own activity, okay? Now, from a company perspective, what you really need to be aware of is companies are going to define regenerative aesthetics very differently. One of the big 3 out there, I'm not going to say which one that they are. I used to work for one of them, by the way, and it's that same company. But they have glommed onto this regenerative aesthetics talk track, but they're doing it with products that have been around for 20 years. So be very, very careful whenever a company comes into your practice talking about what regenerative aesthetics means. Ask them how they define that. From Soneva's, and I believe Sinclair's perspective is, whatever product we're going to add into our portfolio must somehow utilize the patient's own body to give a portion of that cosmetic correction. That's at least how we talk about it. And we believe that there's a real sort of blue sky or green grass opportunity in this space to become a leader in regenerative aesthetics, because if you look at a lot of these small companies, usually the exosome companies are the ones that I talk about. They've got one product, they're independent contractor sales reps, they want to sell a product to you and then they're out the door. Sinclair and Soneva, and why I think that our partnership works so well, is we believe about the industry in very much the same way. We want to support you. That means clinical education. So, for example, if you buy into the concept of InsuLift as a suture-based device that you want to bring into your practice, we actually will send a nurse or a physician's assistant into your practice, do over-the-shoulder coaching as you do it. We believe in the see one, do one, teach one mentality of clinical education. We also have what we call regional training centers, and what I mean by that is you go into an expert's practice and see how they've integrated it into the practice, watch them do it on a few patients, and get you excited about doing whatever procedure you're being trained on. So we invest a lot of money in clinical education. We also invest a lot of money in marketing, and I'll talk about that in a couple slides, but just be very, very careful when these companies are coming in and trying to sell you something. What is the back-end support that they're going to give you? And I can tell you that both Soneva and Sinclair do that very, very well. This basically just shows you every generation of life. If you ask these patients, would you rather have something that is going to cause your body to heal itself naturally to provide that cosmetic benefit? Would you choose that over something different? It's a no-brainer, right? So whether it's the young Gen Zs now that are getting into this space, we'll talk about that in just a moment, or all the way up to 60 years old and older, this rings very, very true. So if you're offering these types of treatments, I think it's only going to grow your practice. 2 points I want to make on this. One is how, over time, the patients that are showing up into your practice has changed dramatically. If you remember back into the early to mid-2000s when you had collagen initially and then Restylane came on board, Radiesse, people were injecting straight into the nasolabial folds. They were injecting straight into the marionette lines. We really didn't understand what facial aging was, how people's faces aged, and how that resulted actually in a nasolabial fold. You were chasing lines and wrinkles. Very, very different than it is today. We now know very, very much about how the face ages. Loss of bone density, loss of fat pads, draping of the skin envelope down, and how to treat that appropriately. But now as this market has aged, and by the way, those patients were typically somewhere between 40 and 75, right, as you begin to think about aging. But now we know that the younger generations are catching on to this, but they're not really coming in there to look younger. They're just, I like the term, I think, it was Dr. Robertson that used the term tweakments, right? They're wanting to tweak something that they don't like about themselves, whether that be a bump on their nose, they don't want to get a nose job, so you can put a little hyaluronic acid above and below it and give yourself a Roman nose that's going to last about 6 months, and maybe then get them on into the surgical practice. But they're looking to do something from an enhancement perspective. 35 to 44, you're talking about prevention, right? So you're talking about patients that are coming in a much younger age before they have facial wrinkles and getting botulinum toxin treatments to prevent those from happening in the future. And then of course you have the anti-aging crowd. Unfortunately, I fit into that crowd now, where you look a little tired, you want to look more refreshed, but we were just having a conversation in the back earlier this morning with a provider, and she was telling me, these patients don't want to look different, they just want to look what they looked like 10 years ago. And so that's very different than where we were 10 years ago. So this is a really exciting time to be part of this market. And I think what we're also beginning to see is patients are going to begin asking for longer lasting treatment options, right? So let's talk about botulinum toxin. Revance, a company that is bringing a botulinum toxin called Daxxify to the market. It's a longer lasting toxin. Now, a lot of providers will think, well, I don't want to give them something that's longer lasting because I want to depend upon that revenue every 3 months as they're coming back for their toxin treatment. But what we've learned through our internal testing and patient surveys is if you give a patient a longer lasting treatment that's going to make them happy, they're going to definitely come back into your practice and use those dollars in other areas, right? The other thing that we're learning is it's not just one type of treatment. It's about multimodal treatment. You can't do just botulinum toxin or just dermal fillers. You need to incorporate RF, PRF, PRP, all of these things, and so those patients need to have that money and cash available to them so they can get those best results. So if you give them the best results with a longer lasting benefit, you're going to end up growing your practice and your patient retention is going to be really, really good. So at Soneva Medical, we have built a portfolio that you see here. Bellafill is the longest lasting dermal filler on the market. It has a 5-year nasolabial fold indication, also has an indication for acne scarring. Of course, it can be used anywhere on the face. That would be off-label outside of the nasolabial fold. But it is a microsphere-based technology, not unlike, it's a sister to Radiesse. The main difference being the polymethyl methacrylate microspheres that are within the dermal filler essentially last forever. So they're going to be giving that patient continuous benefit of collagen production. They'll continue to age, they'll need to come back and get touch-up treatments, but their overall spend in that practice on dermal filler treatments is going to be much, much lower, or they're not going to fall off like many HA dermal filler patients do because they just don't want to get stuck with a needle every 6 months. I will talk about InstaLift in much more detail in just a few moments, but we also have devices and other types of procedures for skin envelope rejuvenation, Plasma IQ, which is an energy-based device for skin resurfacing, CeriGlow MD, which is essentially dermal infusion of things like hyaluronic acid to improve the appearance of the skin, and we have our own PRP-based system, gel tubes, that'll give you a 1.8x PRP concentration, again, to be used in however you want to use it. All right. I've already talked about how we are going to support you as a company. We'll send in the trainers, we'll do the marketing support. So that goes without saying, we want to partner with you as a practice to help you grow your business. We're not just there to sell you something and then you'll never see us again. So what I'm going to do next in the next 11 minutes or so is talk about Silhouette InstaLift. So it is a suture-based device, and I would say it is a cousin to probably what you've already heard about being, I would say, the largest number of devices in this category, which is polydiaxanone threads or PDO-based threads. We believe at Soneva that there's a place for both of these. We do believe that the InstaLift device is far and away, when you're talking about longevity of result, the number of sutures that you will use to get the same degree of cosmetic correction. In particular, in lifting the mid-face and the jawline, this is where this product shines. You can use PDO sutures on other areas of the face, and I'll talk a little bit about the difference between the two, but I'm not here to bash that particular category at all. We do believe there's a place for it in practice, alongside InstaLift. So I'm not going to speak in great detail about characteristics of facial aging because I know that Kara Moncrief has a talk that's going to be, I believe, later this afternoon. in particular about this, and she's a fantastic educator, so I'm not going to try and be as good as she is. But we have learned an enormous amount about how the face ages over time. And essentially, it's increased skin laxity and then loss of volume in three components. The bony surface, so you get widening of the ocular area, you get a widening of the nasal area, and then you get an overall decrease of bone in the jawline. We also know that you have a significant reduction in the volume of both superficial and deep fat pads of the midface, and that's actually what's causing most of the deflation that one sees and then draping of the skin envelope. Now, I would say prior to the re-advent of suture-based devices that work, and if you know anything about this market segment, sutures are nothing new as it relates to lifting tissues in a non-surgical way. The problem was the devices that were produced historically would have problems with either spitting or some issue, and so they kind of got a bad name. They have now come back onto the market in a really good way, both PDOs and Silhouette Instalift, to now the adverse event profile of these devices is very, very clear. We know exactly now, based upon the anatomy of the face, where to inject these in a painless way. The overall use of lidocaine as it relates to anesthesia is very, very minimal. You only have to place lidocaine at the insertion and the exit points of the needle, as I'll show you in just a moment. But those three things, the loss of the bony structure, the loss of the facial fat pads, and then the overall draping of the skin envelope, create that tired effect. And patients are coming in now wanting to have that volume restored, and there's only so much you can do with a dermal filler. You reach a point of diminishing returns where the patient begins to look abnormal. Right? And so you want to combine perhaps dermal filler treatments with the tissue repositioning that we are offering through these suture-based devices to give the best cosmetic result. So prior to being able to do this in a non-surgical way, you really only had three things, right? You had your ability to resurface with energy-based devices. You could relax the muscles underneath with botulinum toxin. You could refill with dermal fillers. But as I just said, you can only reach a certain level of natural appearance injecting a volume of dermal filler. You want to give them the best type of correction that you can, which is usually going to be multiple syringes of dermal filler. But you never really had a good non-surgical way to lift the tissues that are draping down. And that's really the benefit of Silhouette Instalift. It's a very, very simple device. I'm going to try and make it simple to understand, because I remember when I first started working with Sinclair, it was actually before I worked for Soneva Medical. I was a consultant at the time, so I've actually been involved with this device since its original introduction in 2016 into the US market. By the way, as an aside, Soneva Medical is the distributor for Instalift in both the United States and Canada. So the way in which this device works, it has bidirectional cones, and the cones are going to be important for what I'll talk about in just a moment, but cones and actually hand-tied knots. And what happens is you are inserting that into the face and following the normal vectors that we will teach you. And the superior cones are to anchor the suture in place so it doesn't move. And the inferior cones are what's responsible for holding the tissue in place in an elevated position. That's the easiest way that I can describe it to you. It took me forever to get this whenever I was first introduced to this product, but now that I got it, it's simple. So it works in two ways. It has a dual mechanism of action. The first is to actually do what I would call the physical tissue redistribution. And secondly, because of the chemical makeup, which I'll talk about in the next slide, it's basically like what I call Sculptra on a string. We know that Sculptra is a very good biostimulator from a collagen standpoint, and I'll show you data histologically that proves that Silhouette Instalift does this as well. So the dual mechanism of action, collagen production and actual physical tissue repositioning, that lasts for 2 years. So this is the chemical makeup. It is polylactic co-glycolic acid, kind of a cousin to the poly-L-lactic acid of Sculptra. Has a long history of medical use, and so there's really nothing to worry about. It dissolves naturally over time. It's biocompatible and biodegradable, and it's known to stimulate both type 1 and type 3 collagen. I'll show you the type 1 collagen data in just a moment. The workhorse, the tissue repositioning part of this, is the three-dimensional cone. So if you remember from Biology 101 as a freshman in college, at least I remember this, it seemed to be that every answer to every test question was surface area, right? So you'd talk about the microvilli in the intestines, right? Those are there for increased surface area for liquid resorption. It's the same concept with these three-dimensional cones. You're inserting this device into the subcutaneous tissue space. You're repositioning the tissue, and these hollow cones are going to capture the fat cells, and that's what's going to then allow it to lift the tissue, and the knots are basically preventing that cone from moving down further. So you're capturing tissue in the cone, the knot is preventing the cone from moving further, and you're able to keep that tissue in an elevated position, inferiorly or superiorly keep the suture in place within the tissue after you've placed it there. This is what the device looks like. You simply have two relatively long needles that you use to apply the device into the tissue space, and then the bidirectional cones. A very, very simple device. Each package comes in a kit of 10 sutures. What we're learning now, as with anything, you want to treat to the degree of laxity that patient has. So if you're treating both midface and jawline, you're typically doing 5 sutures per side. So one kit is good for one patient, and good physicians and providers who are used to doing this product, there is a little bit of a learning curve, but once you get that learning curve under your belt, you can easily do this procedure in under 45 minutes and place these sutures, and the patient's walking out looking relatively natural, and I'll show you some befores and afters in just a minute. So this is the difference between polydiaxonone threads on the right and the cone technology with Instalift on the left. And again, I'm not here to bash polydiaxonone threads. In fact, at Soneva, we've looked at perhaps bringing one of those devices into our portfolio. But what we do know, just in quick comparison, longevity of correction with a PDO thread is going to be usually on average about 6 months. And longevity of correction with tissue redistribution with Silhouette Instalift is going to be on average about 2 years. So now you're going to have increased patient satisfaction by giving them a longer lasting result that we talked about just a moment ago. You're also typically going to use lower number of sutures to get the overall same degree of cosmetic correction. So on a cost basis, from what your outlay is as a provider to purchase these products, you need to always consider that. How many am I going to use per procedure? On average, I'd say for a midface and a jawline, this procedure is going to, you'd typically charge your patient somewhere between $3,000 and $5,000 depending upon the particular market that you're in. This is the histology data that I spoke about. So this is an interesting study done by Dr. David Goldberg where he implanted the Instalift device. This is in humans, so these biopsies are human skin. You're not going to see the suture on this slide because it is actually below. So what this is demonstrating to you is not only is there an immediate effect around the suture device by encapsulation in collagen, we also know that there is an increased collagen production at sites within the skin that is distant from the device itself. So what you're looking for is in these panels going from right to left at day 1, 3 months, and 6 months after suture insertion is an increase in brown staining with a collagen type 1 antibody. So what you're showing here is that over time you get a very, very nice increase in collagen in those patients. So anecdotally, what we do know in addition to this is that not do you only get this collagen production which thickens the dermal structure of the skin, but you also are able to get skin quality and that lifting effect that we saw. This comes in 3 specific sizes, 8, 12, and 16 cones. What does that mean? Well, basically what it means is you're able to tailor the specific type of suture or thread that you're placing based upon the surface area that you're trying to cover. So we offer you a range of lengths, if that makes sense to you. Right? If you had a patient that came in that had a relatively short midface, you may go for the 8 cones. But if they have a little bit of a longer face or a little bit of a longer midface, or you're going for the jawline, you may go for something like the 12 cone short that offers you a little bit longer of an active length, meaning that the space between the two ends of the cone structure, but also provides you with 50% more lifting capacity by giving you more cones to capture that tissue. We also provide you with anything that you need to be able to do this procedure. So these are basically rulers that help you as you're beginning to learn how to use this device in your procedure. It helps you to map out your treatment plan. It also demonstrates where the entry and the exit points are, and it also shows you where each of those cones are within the tissue. So these are things that we provide you to help you get your legs underneath you. Many providers, once they've done this a few times, they don't even use the ruler because they understand the vectors and they can place these sutures independently of that. So just to end up here in the last 20 seconds, I didn't do it in 5 minutes, that's good. You can see in this patient before and after, she's out 10 months. This is treatment by Dr. Paul Lawrence. He's a plastic surgeon out of Manhattan. But typically where you're getting the most benefit, and I think you'll see it in this patient and in the next one in particular, is going to be in the effacement of the nasolabial folds, right? You can see that. There is absolutely zero dermal filler that's been injected here, as well as in the pre-gel sulcus area. So I think you can appreciate that. Now here's a patient, this is my last slide. This is by Dr. Michael DeWolf. He has basically revolutionized how we're implanting these sutures. He's doing what we call a stacking technique. So he's putting the sutures very, very close together, 3 in the midface, 2 in the jawline. And I think you can appreciate the profound benefit in this lady in her nasolabial folds. The marionette lines in particular look very, very good. Again, no dermal filler treatment, and then a really nice effect along the jawline. So that's my talk about silhouette Instalift. If you have any questions, please feel free to grab me at lunch. I have to leave this afternoon to go see my kids in Raleigh, North Carolina, but I'm very, very happy to be here and also to be partnering with Sinclair. Thank you.